All right, welcome everybody. In the senior care space and in home care, home health, it doesn't really matter either way which one you're in. There's a big factor that you have to try to achieve, and most people refer to it commonly as know, like, and trust. All right, so knowing is pretty easy to achieve. As long as you have a brand out there and you're out visiting facilities, people will eventually get to know your agency and know who you are. That's really going to depend a lot on your personality and on how you interact with your client base. But how do you build trust? That is one of the biggest challenges, especially newer agencies, both in the home health space and in the home care space, that people really have a hard time achieving. So one of the ways to achieve this is by going out and getting accredited with one of the major accrediting bodies. Now, today is today joining us is Nena Hart from Hart Healthcare Solutions. All right, hi, Nena.
Hi.
All right, and she's going to talk to us about what accreditation actually is and why is it really so important. Oh, here we go. So go ahead. Welcome. Introduce yourself. Let us know.
Yeah, thanks so much for having me on today. I'm excited to talk to you. I kind of accidentally fell into the area of accreditation. I was the administrator of a very large hospice provider um, in Tennessee, and we had 27 branches all under one provider. And
Wow.
so we were tasked with becoming accredited. And so it was the largest accreditation survey of a parent provider that ACHC ever did. So it was quite a big undertaking. So I became quite the specialist. And had a lot of help from a great team to do that. But I learned a lot from that, and I really learned a lot about the benefits of accreditation
All right.
for entities. But there are three major providers in home care that offer accreditation services, and that's ACHC, CHAP, and TJC. So those are the
So what do those
three.
stand for? So
Okay, you're
some
gonna
people
put
may
me on this.
not.
You're gonna test my knowledge. So
I am.
CHAP is Community Healthcare Accreditation Partners.
All right.
TJC is the Joint Commission, and ACHC is the one I should really know, and that's Accreditation and Certification Healthcare. Wait, ACHC. Oh gosh, I'm gonna have to Google it. I'm gonna
All
say
right.
it wrong.
Well, that's fine. They can always you can always go to her website and find out all of this stuff.
Yeah, yeah.
Yeah.
So
All right.
it's they're all accrediting bodies that CMS has given the deeming power to certify and recertify entities. So
Okay.
the Centers for Medicare and Medicaid have given them the ability to make that decision on their behalf,
Right.
which means CMS does not survey you for 90% of the time. So I think CMS does around 10%. I don't know what the actual number is, but under
Hmm.
10%, let's
Okay.
say, of verification surveys.
Hmm.
So um, it's very rare, 10% of the time, if you have a survey from one of those three entities, that CMS will come back in and resurvey you as a verification survey to say they're going to verify the results that ACHC found.
Okay. All right. And so now tell me, why is it so important to actually be certified? I mean, that's a question I actually get asked a lot. Like, why would you want accreditation?
There's a couple reasons. One reason, like you talk about a lot of the time, is that know, like, and trust. That's a way to build trust, is to establish the quality of care that you provide. So not only are you meeting the federal and state guidelines set forth for the quality of care an organization provides, you're going and taking another step. So that does a couple things.
Mhm.
That improves the quality of care and the outcomes you see as an agency, because you've already got these guidelines in place kind of guaranteeing that you're at least trying to provide the highest quality of care there is. You've implemented best practices clinically
Mhm.
and operationally to ensure that you're going to see the outcomes that are the highest quality.
Excellent.
Um,
Okay.
but also because um, that's a big risk factor. So that mitigates a lot of risk. Saying you're going, you not only are you meeting, the bare minimum guidelines that this your state said you've got to do this, you're going above and beyond that, your next level. So that also helps mitigate risks of other negative outcomes, from maybe not having as much in place as you could, as far as your processes. um,
All right. All right. So now, for those of you that are just joining us, this is Nena Hart with Hart Healthcare Solutions, and we're talking about accreditation. And if anybody has any questions that's watching this, please feel free to jump in, type it in, and we'll go ahead and get them answered for you. Now, Nina, I see that you're certified and you're an official consultant with CHAP, with ACHC, and with
Correct.
Joint Commission, or no?
Joint Commission has the always ready stance, so they
Okay,
don't at this point in time have external certification for consultants. You can
got
be
it.
an internal consultant for TJC and actually do the surveys, but they don't have the same program that
But
ACHC and CHAP does.
But if somebody were to want to get joint commission, you could
Hmm.
definitely help them in
Yeah,
that process.
absolutely.
So now, if I had to, do a apples to apples comparison to the three, and I was just sitting there trying to figure out which accrediting body do I really want?
Hmm.
Which, if I was, let's handle this from different perspectives here.
Okay.
Home care, home health, and hospice.
Hmm.
Which one would I want for each?
So that's really individualized, and all three accrediting bodies have the same core concept. So there's little difference
Mhm.
other than their approaches to how they interpret their own guidelines.
Okay.
So if you were to reach out to ACHC and say, I'm interested in becoming accredited with you, they would send you a copy of their standards.
Right.
Um, from what I can tell, ACHC standards are the most specific, the most detailed. They're very particular. There's some good things about that and some bad things about that.
Okay.
CHAP guidelines, to look at them, are very slim. But when you implement them, they say that's because they want to give you more control over how you run your business and your operations, which can be a benefit a lot of the times.
Right.
But then when you get surveyed, you find out you're not really meeting the guideline because the guideline's not specific to tell you how to do it. Whereas
Uh,
ACHC, they are literally telling you, you need to have this, this, this in place. And you're
right.
like, man, that is so restrictive. Like, I don't want to run my employee files that way. But you avoid a tag because you have all the pieces in place.
Okay,
So
so it's really a matter of personal
it
preference if you
is. It's
want
a
the
matter of
control up
personal
front or at the end.
preference.
Okay.
Yeah,
All right.
and
Mhm.
a lot of the times an agency just has in their head who they want or who they've heard good things or bad things about. I had an agency I just spoke to about accreditation, and they said, "Oh, we already know we're going with the Joint Commission because around here that's the only regulatory body that our competitors and our referral sources take seriously because they're hospital joint accredited. They expect us to be joint accredited." They
Uh,
already knew. They already knew that's what they were going to do.
yeah, that makes sense because I mean, in the past when I've worked with different franchisors and things, they have their preferences also. Like
Yeah.
some will prefer joint commission, others will prefer CHAP. So it really depends. Also on the locality. I know that ACHC is really popular, like down in Florida, and
Yeah.
you know, in the Midwest, you'll find a lot of joint commission. So that's actually great. Now, from a trust perspective, we kind of touched on that a little bit. because of the standard, it's easy to come in. So now, would you recommend a non-medical home care agency to go out and get accredited, or do you really think it's not a necessary expense?
For me, I think it's totally, I would recommend it 100% of the time because number one, like I mentioned, mitigating the risk of other penalties or litigation or legal issues because you're showing you're going above and beyond the standards to do everything you can to provide that quality, regardless of what type of entity.
Right.
But also because this is the biggest benefit I see as a person who deals with surveys and compliance and operations. The biggest benefit I see is the from all three entities that I know of. Now everybody has their one-off experience, but
Hmm.
you're paying for a service.
Correct.
They're not coming in and depending on your state, depending on your entity, but like for example in the long-term care realm, I have dealt with entire teams of surveyors whose kind of goal coming in from the state or federal level was to find that kind of seek and destroy approach, and that is not the majority of surveyors, but I have seen it. So
Right.
most surveyors are just there to make sure that you're meeting guidelines. When you're accredited, you're paying for a service. You're their customer. They're providing an extra service to you.
Right.
So there is an implied partnership approach there, and they advertise that. So it's not like, well, hopefully they'll be a good partner.
Yeah,
No,
that
you're
hopefully is
paying
always
them for a
dangerous.
service. Right.
Yeah.
So
Yeah.
there's a more educational approach to the survey and a less um, punitive approach. So,
Right.
especially for single operators or people who are just starting their own home care business, maybe a non medical, they're not necessarily compliance experts. They're just trying to learn the
Mhm.
business, you know?
Yep.
They want to do the best they can. They want to be compliant, but they don't necessarily know how. And that's the
Right.
whole benefit of accreditation. They're going to come in and teach you and whenever they can say, okay, this is not compliant. Here's what we need to see, instead of an
Exactly.
approach where it's like, um, you're not meeting, we're shutting you down.
Right. That's actually one of the things that I do discuss with a lot of my private pay clients, because as a company, we primarily deal with the private pay market, and
Sure.
one of the big things, like we're dealing with the whether you're going to be a discounter, you're just going to actively compete with everyone else, or you're trying to be that top tier premier service, especially if you're in a state that doesn't have a lot of licensing requirements
Yeah,
for the private pay market. You really want to go out and get accredited, because that's a
absolutely.
standard, and that just it builds so much confidence. It really sets you apart, and above everything else, it shows to the client and to the referral partner that your fee is being justified.
Hmm.
You're not just arbitrarily making up a dollar amount.
Yeah,
You've invested in your business, you've taken the time to assure to learn the right processes, and now you're going to grow your business the right way according to some fixed
absolutely.
standard.
Absolutely.
So yeah, so that's fantastic information. We really appreciate all of this. So now I'm going to put you on the spot. You know,
Okay.
if we have gun to our head,
Yep.
absolutely number one thing to keep in mind when going through the accreditation process. What is it that you would recommend any agency that's considering it, that's, they're just getting started? What is the one thing, the one tip you can give?
Well, I would say that might be twofold. So I would say reviewing their standards very carefully. Um, and you kind of need to take a step back. You can't say, I know I have that in place, I'm good to go, because you
Right.
don't and you aren't. If you haven't read the standards, you are not going to meet them. So if you're
Hmm.
not a detail oriented person, I totally get that. Find someone on your team who is to read over those, who's going to give you an honest answer. Um,
Right.
who can come in and really give you a disconnected and objective opinion. Because when you've done the work and you've put the blood, sweat, and tears in, you cannot see objectively that you are not meeting the standards.
Right.
It's very hard, close to impossible, to objectively evaluate yourself and you're meeting the standards. A surveyor will not agree with you. So that is the first thing I would say. The
All right.
second thing I would say is, as far as deficiencies go, if you're asking like, what is the number one thing they need to look at as far as deficiencies, it's going to be
Right.
care plans. Regardless of what type of care you provide, skilled or non-skilled,
Hmm.
you have to have a collaborative plan of care that reflects the communication, including the patient, the physician, and the entity, closing the circle between the agency, the patient and their representative, and their primary care physician. So that is where the majority of the deficiencies are going to come from.
Okay. All right. So we have a question here. Somebody says, I need to know what do I need to do? I'm assuming they mean to get started. Okay,
Yeah.
that's the assumption here. So
Yes.
how would they get started?
Well, I think if they want to get started with accreditation, they should kind of explore the three primary accrediting bodies and see which one they feel like would be a good fit. For me, I do recommend ACHC, only because if you're just starting out, they have very specific standards. They give you everything you need in the standard to meet it. Whereas with CHAP or TJC, there's more, it's open to interpretation.
Okay.
You have to have your own systems, you have to implement your own ways to meet those standards, and that can be a little more challenging for someone with no compliance background. In
Right.
my opinion, that's
Yeah.
just a professional opinion.
Yeah. Look, we all draw opinions from our own experiences, and you got to trust somebody who's been there. At least that's the way I look at it.
I think they're all good. I think they're all
Yeah.
very good accrediting bodies. They're all good to work with. They all are great assets to use. And so
Right.
it's just kind of personal preference there. And my personal preference is ACHC.
Right.
Um,
And so ACHC is more user friendly, so to speak.
in my opinion, yeah, I
All
think
right.
they've been. I've worked with them the most, also. So maybe it's just a comfort zone. Like I'm just used to dealing with them and their approach,
Right.
and they've been very consistent with for me. I've heard, and again, hearsay. I've heard some stories of bad experiences with TJC and CHAP from recent clients
Hmm.
that they felt like it was not a very collaborative approach, and it was, and that could be because I'm seeing a trend that CMS is cracking down on some of these pop up organizations who pop up, bill, and then close down, and they're trying
Yeah.
to prevent that. So they're being a little bit harder on the accrediting bodies for licensing these agencies. They
Right.
want to see that they're really doing a thorough job and they're holding them to a high standard. So that could be it too.
And now some I've worked with CHAP directly before. I've had like periphery experience working around agencies that have used Joint Commission. But CHAP, I know that in certain states they will have a requirement of a certain number of private pay clients or existing clients, whether private pay or Medicaid. Is
Hmm.
that standard across the board, that requirement of a certain number of clients?
Hmm. Yeah, they're not going to, be willing to survey an agency who hasn't cared for any patients,
Okay.
which makes it really challenging because you're like, wait a second, how am I supposed to? It's like that old vicious cycle of I'm trying to get a nursing job, but I don't have a year of nursing experience. So
Yeah.
how am I supposed to get a year of nursing experience when no one will hire me for a job?
Well, I
You
mean, the
know?
private pay part, if they're looking for clients, they can just reach out to me. I'll happily help them out.
Yeah.
but, but yeah, no, but that is a challenge, though. I do agree. Now, what about states like, for example, like New Jersey? I'll use this as an example. New Jersey has a requirement in order to stay licensed, you must have accreditation. So that's
Wow.
got to be
Okay.
an extra challenge, So that's got to be an extra level of challenge, especially if if you're new, you just got licensed, and
Yeah.
you only have a very limited window.
Yeah.
So how do you quickly put something like this together? I mean, you in particular, I know that there's consultants out there like what you do that can do this, but is a short notice accreditation process something that you would be able to handle and help someone with?
Yeah, absolutely. So ideally, especially if I think the most time consuming process that I've been through is transitioning accrediting bodies because you're trying to play a very fine line between survey to survey, and
Right,
so you need at least a year.
right,
And down to the wire. I just did one within 6 months for a transition that was from CHAP to ACHC, and that went
okay.
really really well. But
So
it took
transitioning is complicated, but just fresh new
yes.
office, it's not that big
Yep.
a deal.
And
Okay.
they understand those limitations. They know the
Mhm.
state, guidelines for the states that they survey better than anybody else.
Of
So
course.
they know, okay, we don't have time. We do have time. And they can give, you get an account specialist. They have different names, but a
Hmm.
partner, an account advisor. And they will say, here's our timeline. Here's your state's turnaround time on this. Here's when CMS will decertify you. Here's when they'll come, here's when we need to come in by because we need to have at least 30 days and then we need another 10 days in case you needed to have, a plan of correction in place. So they are very aware of those time sensitive situations as well.
All right. Awesome. Awesome.
And it
All right.
mostly depends
So
on what you've got in place. If you have
yeah,
systems in
I would
place,
imagine.
we can
I
work
would
with that.
imagine it's probably easier to deal with somebody who's under, for example, a franchise system that's already
Yeah.
got a lot of policies and procedures, versus somebody who's just very literally starting up, from scratch, that's
Yeah.
trying to put everything in place that they may not have these things already
Yeah.
created.
And
So
I
yeah.
think
So
policies and procedures are a sticking point for a lot of agencies
yes,
because they're expensive,
yes.
and they're time consuming to develop. Um, so most of the agencies I work with purchase theirs externally, and we just go through them and make sure that they align with what the organization is actually doing. That's a big
Mhm.
deficiency area for a lot of agencies is that their practices don't reflect their policy. So you
Yeah,
didn't follow
and
your own policy.
on that note, that's something that I'm probably going to upset a whole lot of people in this world right now that will watch this video. Look, if you're a new agency and you're trying to start up, please be careful where you're buying your policies and procedures.
Yeah.
These people that are trying to sell you a set of policies and procedures from like $50 to $300, they're not going to work. You're
No.
going to end up down the road having to spend 4 or 5 extra thousand dollars to correct what you wanted to save a few dollars on in the beginning.
Yep.
Right? In Spanish, we have an expression that loosely translates to that the cheap comes out expensive. Okay,
Yeah.
and I understand. I trust me. I work with a lot of agency owners that are a little bit on a tight budget,
Hmm.
right? But you're much better off holding off and saving up that $2,000 to $3,000 to buy a good set of policy and procedures with somebody that will work with you and understand how you run your business than you are spending $50 to $300 because Sally Mae down the street just posted something on Facebook saying, "Oh yeah, I'm selling policies and procedures for $300. I made them myself."
I can tell
Oh,
you that I do not make policies and procedures. I do
oh
not
yeah,
offer
yeah.
that
No, no,
because
I don't either.
I don't know your state guidelines well enough to keep that up to date and current. And
Yeah,
I have a very slim few of policy and procedure companies that I recommend people to
yeah,
buy
yeah, yeah.
from that are compliant.
Yeah, I don't work with a lot of compliance companies when it comes to policy and procedure. I don't do them. It's just a general warning because again,
Yes.
I come from the world of franchising, so I'm very familiar with what they need to look like in a general sense. All right, but the specifics, they really change drastically from one state to another, and people that are out there selling generic general policies and procedures for like 2 or 300 bucks. They're just trying to make a buck. They're not really concerned about whether or not you're going to be able to successfully open your agency.
And you need
So
to have for
keep that in mind.
accreditation,
Mhm.
they need to align. your policies and procedures will need to align with the standards and how you meet them. And if you create policies and procedures yourself or purchase them for a few $100s, I assure you they will not align. What
Yeah.
happens? And then I get a message on Facebook. Can you recreate my policies and procedures
Mhm.
from the ones I bought to align with the standards? And the answer to that question is no.
Yeah,
I
yeah,
cannot.
that's a
Cannot
big
be done.
deal. That's a really big deal, especially when it comes to charting.
Yeah.
Because that again, I understand from my own experience. Charting rules in like New Jersey are different than they are in California. They're different than they are in Florida.
Hmm.
And you really got to understand all of this stuff. Dot your I's, cross your T's, and everything goes a lot smoother.
Yes.
So
A
that's
lot of the
just
time the
my
state will come back on those policies and say
yeah,
this doesn't meet the state licensure
yeah,
guidelines for what you're doing,
exactly. I mean,
even
just
aside from accreditation.
I'll just give a random example here. In Florida, for example, you have to have your license number on any client-facing material. That's
Hmm.
not a regulation in a lot of other states.
Right.
So if you're buying randomly a set of policies and procedures and you're not aware of that, and you're opening in Florida, you're going to get hit with some pretty hefty dings. And the plan of correction for that is not as simple as okay, I'll just go back through and put my number on stuff.
Right.
Yeah, it's a lot more complicated. So yeah, just a word of warning. But thank you so much, Nina. Everybody's watching us. Last chance. If you guys want to ask a question, go ahead. If not, this is pretty much going to be it for us today. We really appreciate your time, and we really appreciate you sharing
Thank
some
you
of
so
your
much. It
expertise
was
with
great
us.
talking to you.
All right, fantastic. And
Have a great
everybody
weekend.
have a great day. We look forward to speaking with you all again. Remember, every Wednesday and Friday we are live sharing some bit of information. All right, have a good one.